Spot diagnosis in musculoskeletal ultrasound, case number 5. It's a 28 female, vegetarian, non-lactating, presented with complaints of mildly painful lump in upper outer aspect of right breast when she noticed since few days. There was no history of fever, no history of trauma, no family history of breast cancer. On examination, there was this firm, poorly defined lump located above the axillary tail of right breast. It was mildly tender and there were mild signs of inflammation. This patient was referred for breast ultrasound. These are the images of all 4 quadrants of right breast, which typically shows normal breast parenchyma. There was no solid or cystic lesion anywhere within the breast parenchyma. But as I glided my probe superiorly above the axillary tail, what I could see was this complex cystic lesion. We can see a well-defined, thick-walled, complex cystic lesion with dense, homogeneous internal echos within its outer portion. Whereas in the central portion of the lesion, there is this thin-walled, clear anechoic cyst with a comma-shaped structure that is attached to one of its walls. That's a panoramic image which nicely demonstrates the entire extent of this lesion. So we have identified the lesion, but where exactly it is located. For that, we need to know various layers of anterior chest wall. We have skin at the top, subcutaneous fat, pectoralis major, that's a complex cystic lesion, pectoralis minor. So it seems that this lesion is probably arising from pectoralis minor muscle belly, or it could even be arising from the deeper fibers of pectoralis major. Then we have deep fat layer with axillary neurovascular bundle, serratus anterior and the rib. So, what is the diagnosis? These imaging features are very characteristic for Myocysticercosis. This comma-shaped structure within the lesion is in fact partially calcified scolex, and if we put on the color Doppler, we can see increased vascularity within the wall of this lesion. This is because this peripheral portion of the lesion is in fact an inflammatory reaction that is incited by the cysticercus granuloma. Myocysticercosis is a parasitic infection where larvae of pork tapeworm, Taenia solium, encyst within skeletal muscles, resulting in pain, inflammation, and sometimes swelling and pseudo-tumor formation. It is caused by Cysticercus cellulose, that is the larval stage of Taenia solium. Infection occurs typically by ingesting raw pork meat, but it can even occur in vegetarians by ingesting food or water contaminated with eggs. Most common sites are central nervous system, followed by vitreous humor of eye, striated muscle, and in rare cases, subcutaneous tissues. Diagnosis: high-resolution ultrasound is often the preferred, cost-effective initial diagnostic tool, showing the characteristic cyst with its internal scolex. MRI may sometimes be used to confirm or rule out involvement in other areas. Treatment is typically conservative with antihelminthic drugs, sometimes combined with corticosteroids to manage inflammation. Surgical excision is, however, rarely indicated, particularly in refractory or abscess-forming cases. So, high-resolution ultrasound is generally considered as the imaging modality of choice for the evaluation of soft tissue lumps, and this case highlights how exquisitely ultrasound does its job. I hope you find this case informative. Thanks for watching.